Let's study something until you become a neonatologist. I'm a pediatrician and neonatologist. Today we're going to look at a chest x-ray. I'm just going to go through a system. Anytime you order a chest x-ray, you should be looking at your own imaging. So some people have a system, A, B, C, D, E, airway, breathing, cardiac, diaphragm, everything else. I don't ever remember that in the moment, so I just kind of have my system. So let's start here. We have a baby, and I'll look at the airway first. I want to look at the trachea, see if it's midline. It looks mostly midline. Baby's a little bit rotated because that clavicle is up more compared to the other. So that looks fine. I don't really see the carina or the right main stem branching off. I'm going to look at my lung fields next. They look pretty good. I am making sure that the lung markings go all the way out to the bases and the diaphragmatic angles. And over here, this little guy, it looks like, I don't know, it's hard to see. It looks kind of like a bubble. So it looks kind of hard to see if whether or not that lung markings go all the way out to the diaphragm, and same with this angle over here. When I look at the cardiac silhouette itself, and you want it around 2/3 the size of the chest diameter, and ballpark saying that's 2/3. But when I look more closely, I see this like darker line here around the heart. That marking, it should kind of be this lighter gray all throughout, not that black. So what I'm seeing, bones and everything else look fine. What I'm seeing is probably bilateral small pneumothoraces. Baby doesn't appear to have a feeding tube in or anything else. So chances are some babies just get these when they're born. There's nothing to do about it. As long as they're breathing okay and they can eat, it will resolve on its own over time. Now remember, when we take x-rays of babies, they are laying flat on their back. So if there is extra air, it's going to sit at the top of the chest. So some sneaky little spots where the air will sit is around the heart border, or you'll just see these like small lines along the side of the ribs, or that little bubble that's kind of the base. If you have an adult and they have a pneumo and they're standing upright or sitting upright for the film, that air is going to go to the apices of the lungs, which we don't typically see as often in babies. Unless it's a massive pneumo, then you'll kind of see the whole lung shrunken down, but you'll see it in these little subtle places for babies.